Since the beginning of the COVID-19 pandemic, the majority of countries have faced or threatened a shortage of personal protective equipment. As a result, healthcare professionals have been forced to perform high-risk aerosolization procedures without being able to wear the appropriate PPE. A Taiwan anesthesiologist, Dr. Lei Xian-Yung, designed the first aerosol box that consisted of a plastic cube with 2 openings at the patient's head to pass the hands of the provider in charge of intubating a proven or suspected COVID-19 patient in respiratory failure. Thanks to the enthusiasm and innovation of Dr. Philippe Jouvet, paediatric critical care physician at the CHU Sainte-Justine, and Dr. Carl-Éric Aubin, executive director of Trans MedTech, along with the collaboration of healthcare professionals from the PICU, the ED, and the OR, and the Centre de Simulation Mère-Enfant Simulation Program, we designed 2 plexiglass boxes called Splashguard CG, an adult model and a pediatric model, allowing for aerosolizing techniques such as nasopharyngeal suction, bag valve mask ventilation, intubation, and non-invasive ventilation to be safely performed. The Splashguard is a plexiglass box that is placed above the head and shoulders of the suspected or confirmed COVID-19 patient in order to limit the risks of aerosolization when the patient coughs or when performing aerosolizing techniques. It offers additional protection to healthcare providers, but does not replace the PPE recommended during aerosolizing procedures. Description of the box. The box conceived at the CHU Sainte-Justine has 6 holes to attach the box to the stretcher, 6 openings to insert the arms and hands of the providers during procedures, 2 lateral and rear half-moon openings on the side to introduce the connection of the ventilator and the suction equipment, 2 small half-moon openings at the head of the box to introduce the oxygen pipe from the Aeris balloon or the self-inflating bag. We have also added a transparent plastic drape to cover the open part of the box, which is on the side opposite the patient's head. In this video, we will introduce you to the use of the Splashguard when managing the airway of a critically ill, suspected or proven COVID patient in a negative pressure resuscitation room. More specifically, the learning objectives of the video are: 1. To show where the Splashguards are stored in the ED of the CHU Sainte-Justine. 2. To illustrate how to proceed when preparing the Splashguard. 3. To demonstrate the safe installation of the Splashguard. 4. To demonstrate various techniques such as nasopharyngeal aspiration, bag valve mask ventilation, and intubation using the Splashguard. 5. To demonstrate how to safely remove the Splashguard in the events of an emergency. 6. To prepare for intra-hospital patient transport and to demonstrate how to manipulate the Splashguard upon arrival at the PICU. 7. To explain the maintenance and disinfection of the Splashguard after use. In the current context of equipment shortages, please note that in our video, we are using only expired personal protective equipment and used medical equipment. The Splashguards are stored in the emergency room at the bottom of the staircase located between the resuscitation room 2 and the bathroom near the ambulance garage entrance. There should be at least 2 Splashguards pre-assembled at all times. The person responsible for assembling a box is the nurse who is responsible for reassembling the resuscitation room after the patient leaves when a box has been used. The cords must be inserted into the holes and secured with a knot. A pair of scissors must be taped to the top of the box at all times so that you are ready to cut the cords immediately if it becomes necessary. The plastic drape, as well as the 4 specific plugs intended to obstruct the lateral openings during transport, must be also taped above the box. It should be noted that the emergency department at the Urgencehsj.ca only has the pediatric format of the Splashguard because the width of the adult model is not compatible with our resuscitation stretchers. The larger adult model is available in the pediatric intensive care unit. Slightly raise the mattress on the resuscitation stretcher to allow the installation of the Splashguard. Ideally, the mattress of the resuscitation stretcher in the resuscitation room is already in this position. Thread the 6 strings through the hole of the box if you have not already done so. Slightly raise the movable portion at the head of the stretcher to facilitate the knotting of the cords. When installing the Splashguard on the stretcher, a person must hold the box at all times until the 6 cords are tied. Attach the cords to the base of the stretcher, not to the drop sides, or the outer frame of the stretcher. Install the self-adhesive plastic drape to cover the open portion of the box. Do not cover the side openings. If adhesive tape is used to fix the plastic portion, stick only the upper side of the plastic, not the lateral sides. Do not create a sealed environment with the plastic shield. Nasopharyngeal aspiration technique. The person aspirating the patient must place him or herself on the left or right of the plexiglass box, depending on whether they are right or left-handed, or according to the usual way they proceed at the bedside of the patient. Bag valve mask ventilation with HEPA filter. The person who performs a seal with the mask should ideally place himself at the head of the patient and insert his 2 hands through the head openings provided for this purpose. Another person performing the ventilation stands on the patient's right or left, depending on the location of the oxygen connections. Intubation technique with the video laryngoscope. Ensure that the Splashguard does not interfere with the act of intubation. A pair of scissors should be taped to the top of the box at all times. Wear the appropriate PPE, including 2 pairs of gloves for the intubator. You can refer to the protocol on the management of critically ill COVID patients in the resuscitation bay and to the video designed for this purpose. The respiratory therapist positions himself on the right or on the left of the patient according to the ergonomics of the room and the preference of each. Use the lateral and rear half-moon openings to introduce the connection of the respirator and the suction equipment into the box. Use the small half-moon opening to introduce the oxygen pipe from the Aeris balloon or the self-inflating bag. Make sure you have all the necessary equipment inside the box before starting the technique. Lay the stretcher flat if desired. Adjust the height of the stretcher according to the needs of the intubator and the team. Following intubation, the proposed position for aspiration with the trachea is as follows. Place yourself to the right of the patient if you are right-handed, with the arm holding the endotracheal tube in the distal lateral opening and the hand holding the suction tube passes under the plastic shield. Demonstrate how to safely remove the Splashguard in the event of an emergency. There are conditions that will require removal of the Splashguard. Any emergency for which access to the patient is hampered by the Splashguard, such as a patient in cardiac arrest. The Splashguard can significantly interfere with the placement of defibrillation pads and cardiac massage. If you ever need to remove the Splashguard urgently, the withdrawal technique consists in ensuring that someone holds the box at all times while cutting the cords. Make sure that no wire, hose, etc. passes through the openings provided for the arms. You must fold the plastic shield inwards. A person must be designated to ensure that no tubing, circuit, or hose is moved or disconnected during the manipulation of the box. Preparation for intra-hospital transfer. When preparing for an intra-hospital transfer, it is important to lift the drop sides and ensure the stability of the box before you begin to move the stretcher. Adequate analgesia and sedation for the patient should be prescribed. it is important to place the plugs on the side openings of the box before departure and to secure them with adhesive tape. Before leaving the resuscitation room with the patient, the team members who were in the room must change their gloves and gown and wash their hands at each step. The sides of the stretcher and the handles of the pumps and ventilator must be disinfected. The patient chart must be placed in a plastic envelope to avoid contamination. Handling of the Splashguard upon arrival in the intensive care unit. Ensure that all healthcare personnel responsible for patient care wear the appropriate PPE. Remove the material which is introduced into the box through the openings provided for the arms. Undo or cut the 6 fasteners from the box. Roll the plastic shield up. Watch out for material contamination. One person should be responsible for ensuring that the box is stable throughout the process. Tilt the Splashguard backwards and place it on the ground. Be careful that no tubing, circuit, or hose is moved or was disconnected upon manipulating the box. Transfer the patient to the intensive care bed according to the usual procedure. Install a new Splashguard box at the patient's head and shoulders according to the procedure already described. Use a pediatric or adult Splashguard depending on the patient's size. Maintenance and disinfection. When the patient leaves, leave the device on the bed so that household maintenance can carry out a first disinfection according to the following recommended protocol. Use a solution of 2 tablets of Zoclar in 1 liter of water. The concentration of 3.6 grams of sodium dichloro-S triazinitrione, 2000 ppm of chlorine. Then, carry out a small disinfection with a disinfected wipe available at your hospital. Use hydrogen peroxide 0.5%, making sure to remove all traces of glue. If a non-transparent film remains, after the drying period, start again, rinse, and dry the wall to facilitate the patient's vision. Store in a dry place.